This is the award-winning Lee Pitts Live.
Brought to you by the North Law Firm. For car accidents and negligent security cases, call Joe at 239-337-1191. By Crime Stoppers of Southwest Florida. Report crimes and get paid with nobody knowing your identity. 1-800-700-TIPS. And by Lee Health.
Hello, and welcome to Arise to Your Health at Lee Pitts Live with Yajaida Vasquez, and I am your host, and it's brought to you by Suncoast Medical Centers. So welcome again. Here we are again to have our little candid conversation about medical issues that you may be interested in, and we're just trying to keep you nice and healthy, Southwest Florida. So today we're going to be talking about a disease that's affecting many millions of Americans. As a matter of fact, 30 million Americans suffer from this, and many, many more don't even know that they have it. And so it's important that we talk about it because it's truly affecting our daily lives. It's affecting the cost of health care. And we just want to make sure that you are, as always, informed, educated, and empowered to take care of yourselves and ask your medical providers on how to better take care of yourselves. So today we're going to be talking about diabetes. And I know that you know someone that has diabetes. If not, you're affected by it yourself, or maybe your healthcare provider had mentioned to you at some point that you were close to perhaps being a diabetic. So that's why it's so important that we talk about this today. So let's talk about what diabetes is. Let's make it just real plain. So plainly, it's a chronic health condition that affects how your body processes sugar. And we do need sugar in order to have energy. So sugar is not always a bad thing. It's just that we need to make sure that we eat the right kinds so that we can get the right kind of energy. So when food is broken down into sugar, also known as glucose, the insulin from the pancreas then helps the right amount of that glucose get into the stream and give you the energy that you need. What happens in diabetes is that too much of that sugar stays in your bloodstream, and then it causes havoc, and that's what we don't want. So there's two types of diabetes that we want to talk about. The first one is type 1. And in this type of diabetes, what happens is that your pancreas just does not produce that insulin that you need in order to break down that sugar for energy, like I said. And then in type 2, what happens is your pancreas does work, but it just does not work well enough. And type 2 is the one we're going to be talking the most about today because it's affecting most of us these days. It used to be an adult onset diabetes, but we're seeing that in too many children and teenagers these days. So what happens also is that there's people that have high blood sugars that cannot be diagnosed as diabetics, and those have something called insulin resistance, and we'll be talking a little bit more about that. Some providers call that pre-diabetes, so that we still need to also pay attention to. So what are the risk factors? Let's talk about that. So unfortunately, some ethnic backgrounds are affected by this more than others. If you are African American, Latino, American Indian, chances are that you can develop diabetes. Also being overweight, having family members that have diabetes, not being physically active, or if you were a woman that that was pregnant and developed diabetes or something called gestational diabetes, then you're at risk as well. So what are the symptoms then for diabetes? Well, one of them is increased thirst, increased urination or going a lot to the bathroom, fatigue, increased hunger. So you see how these can be just very, very vague, and people may recognize those as a problem, but they truly can be. So the first thing we need to do is make sure that we talk to our medical provider about that, even though they sound like vague and some people don't even have any symptoms at all. So what do you do if you suspect that you have diabetes? Well, the first thing is that you need to get tested. Go and see your medical provider. Talk about these symptoms that you're having and see if they agree that this is something that seems like it could be diabetes. So they can check your sugar or your glucose by just pinching your finger and just checking their random sugar. But also a more effective test that you can ask for is called the hemoglobin A1C. And that test gives you 3-month average of all of your sugars. And it's actually what we use not only to diagnose diabetes, but also to make sure that whatever treatments that you're taking are the proper ones. Once you have those numbers, then your medical provider can tell you where you are. And if you are officially diagnosed as a diabetic or as a pre-diabetic, then they can tell you what kinds of things you need to do for your health, like losing some weight, getting active, and in some cases, start you on some medications for your treatment. Because the main thing is that we want to make sure that we prevent other complications further on, like heart disease, high blood pressure, or problems with your kidneys. Now, the key is that although diabetes is not something that is cured, and I hear this a lot, people tell me, so I just had diabetes before. No, if you're diagnosed with diabetes, you will always have diabetes, but what's important to know is that it's preventable in most cases, and even if you're diagnosed, that it can be easily managed by you and your medical provider. The more empowered that you are and the better decisions you make, the better that you will be. So the sooner that you know those numbers, and the faster that you get into a treatment plan and doing some things for your health, then the better outcome that you will have. So make sure that you talk to your medical provider soon enough, get all those symptoms checked, and if not, go for your prevention check and make sure that they check these very important tests like your glucose or your hemoglobin A1C to make sure that you don't have diabetes, and if you do, that we can take better care of you and we can keep you healthy. So that is all the time that we have today. Join us again for our next Arise to Your Health with Yajaida here at Lee Pitts. And in the meantime, Southwest Florida, stay healthy. Bye-bye. Thank you so much. And now we're back to Lee Pitts Live.
Hi, everybody. Thanks for watching Lee Pitts Live. Of course, I'm Lee Pitts, the host of Lee Pitts Live. We're here at the Holiday Inn Airport in Fort Myers, and I want you to continue to watch Lee Pitts Live on television, on YouTube, and of course, listen to us on radio. But to get all of your shows to come right to you, just click on that subscribe button right there, and Lee Pitts Live will come right to you, your time, your way. That's Lee Pitts Live.